Today we will talk about gestational hypertension during pregnancy, pre-eclampsia and pre-existing hypertension through answering an MCQ question. So the question is, which one of the following women has gestational hypertension? And we have 5 answer options, each giving us information about gestational age, blood pressure and whether there's any protein in the urine. So you're more than welcome to pause the video and we'll be going through the correct answer option and why the others are incorrect. The correct answer is option D, 22 weeks gestation, blood pressure 150/100 and no protein in the urine. Before we go through the question, let's talk about what is gestational hypertension. And to make this diagnosis, we need to think about 3 components. The first being blood pressure, which needs to be greater than 140 systolic or greater than 90 diastolic. Second being gestation, and the pregnancy needs to be greater than 20 weeks, which is when it's entered the second trimester. And also we need to make sure there's no protein in the urine or evidence of edema, which may make us think of a different diagnosis. And other things to consider is if there's hypertension before 20 weeks, that could indicate pre-existing hypertension. But if there's hypertension after 20 weeks, in addition to protein in the urine, we need to carefully consider whether there's pre-eclampsia in this person. Going back to our question at the start, option A was 16 weeks gestation, blood pressure 140/90 and no protein in the urine. This was incorrect because whilst we have a blood pressure of 140/90 and no protein in the urine, which supports the diagnosis of gestational hypertension, the gestational age is less than 20 weeks. So this picture is more in fitting with pre-existing hypertension. Option B was 24 weeks gestation, blood pressure 150/100 and protein +3 on analysis. Now this was incorrect because whilst we have a blood pressure of 150/100 and the gestational age is greater than 20 weeks, what goes against gestational hypertension is the protein in the urine, and this is more suggestive of pre-eclampsia. Moving on to option C, which was 10 weeks gestation, blood pressure 140/100 and no protein in the urine. Again, this was incorrect because, again, whilst we have hypertension and no protein in the urine, the gestational age is less than 20 weeks. So like option A, this is more indicative of pre-existing hypertension. In option D, we have 22 weeks gestation, blood pressure 150/100 and no protein in the urine. This was the correct answer because we have all the components of gestational hypertension. The blood pressure is greater than 140/90, the gestational age is greater than 20 weeks, and there is no protein in the urine. In our final option, we have 32 weeks gestation, blood pressure 160/100 and protein +2 on analysis. This was incorrect because whilst we have hypertension and the gestational age is greater than 20 weeks, there is protein in the urine which is more suggestive of pre-eclampsia. Thank you for watching this video on pre-existing hypertension, gestational hypertension and pre-eclampsia. Hope that was helpful.